You ever experience that pain right back in here was just kind of a sharp, where you can't hardly move? It's your sciatica. And it's something that if you don't get any kind of treatment for over a period of time, it can really cause you some pain for a long period of time. That's why you come to Dr. Sonia Spencer.
Hey, Jim.
How you doing?
Wonderful.
Good,
wonderful.
good.
We're talking about one of my favorite things.
Mm-hmm.
And so I call it that pain in the butt. Have that pain in the butt.
Uh-huh.
Yeah, usually it's on one side.
Right.
One side or the other side. And there's a ton of different causes for it.
Mm-hmm.
Some occur in the disc and some occur outside of the spine.
Mm-hmm.
But anyway, let me just tell you a little bit about it. The nerve is actually formed from the lowest segments of your lower back and come out and form the largest nerve in your body is your sciatic nerve. Largest nerve in the body. And it can cause excruciating pain.
Oh, I know.
I mean, I have people come in here in tears with this. I mean, it's nothing to play with. And generally, people will have recurring episodes of this type of pain. Maybe they go in and they get, it's so bad they go to the emergency room or somewhere like that, and they have to get some kind of steroids or something to get it under control because it can get that severe. But if you don't treat what's causing it and your steroids are over, you may find yourself in recurring episodes of severe pain. Well, you might go ahead and go get an MRI. Maybe somebody orders an MRI on you and they find out that you have a disc problem. So this is a real cause of sciatic nerve pain, is when the disc material bulges out and can press on that nerve.
Oh, I see that, yeah.
Yeah, and when that happens, it can be recurring over and over. Say you're feeling really good, and you decide you're gonna, hey, I'm gonna plant some plants for my wife. I'm gonna do my honey-do list. She's been asking me to do all this stuff, so I'm gonna go out and I'm gonna well, because the disc was never healed, it doesn't take much to set it off again. And usually people, once they have so many of these episodes, they're so severe and so debilitating, they might start considering having surgery.
That's not necessary.
Well, in most cases it's not, because this can be, the disc can be healed in many cases by chiropractic or our decompression therapy. Decompression therapy is life-changing for someone who needs it.
Right.
So say you're having, I recently had a patient who had been athletic, most of his life, and was below the age of 40, but it had given up sports because, every time get out there and aggravate this pain in the butt, right? Severe, debilitating pain. And, I was about his third or fourth chiropractor, and so I'm like, well, traditional chiropractic is probably not going to work for this. You've been on steroids, you've done everything but surgery. Let's go ahead and do the decompression. And now he's coaching again.
All right.
He's coaching team sports again, which is pretty exciting, because when your pain is so severe and you start saying no to life, no, I'm not going to do this because my back's going to hurt. No, I'm not going to do this because my neck's going to hurt. Or no. The pain can take away your quality of life, and it's so subtle that, before long, you're not doing much of anything,
Right.
And that's why I love chiropractic, because that's why I love what we do. It helps get patients back on their feet without drugs, shots, surgeries, or painful interventions. The decompression is so comfortable. Most people get on it and they take a nap. I mean, they're falling.
That would be me.
They're falling asleep. We can hear them in there snoring, and they're just enjoying.
That would be me.
Yeah, but it's so life-changing for these debilitating disc problems. And what triggers me is when a patient just keeps having the episode over and over and over again, and they can get better, but they can't stay better. So that's generally how I know they have this disc problem.
And I know a lot of people that, sit all day long at a desk after a period of time. That will start tightening up on them, because I've had it happen to me before.
Oh yeah, so yeah, this is the one cause, and the second one is sitting. So you think about it, you're basically sitting on that nerve, all day long, and sitting is one of the main causes of back and nerve pain. You shouldn't sit more than an hour without getting up for 10 minutes. But if you sit and a lot of men sit on their wallet, or they get imbalanced, or we have this happening a lot where people, you know, are sitting at their desk and then they're constantly leaning into one drawer to get the stuff out over and over. That repetitive motion of putting pressure will cause those butt muscles to over tighten, and it'll be pinched out. The sciatic nerve will be pinched outside of the spine. So generally, once we fix those muscle problems, and sometimes they have their hips are out of line because they've been sitting crooked or sitting on their foot or repetitively.
Women do that a lot, sit on their feet.
Repetitively do something that's not posturally correct. Kind of like the technique we talked about.
Yes, yes.
But if you do something in a way that's harmful to your body over and over and over again, it can cause nerve pain anywhere.
And it doesn't matter. I mean, some people think, well, I won't have to worry about that until I get older. That's not right.
No, I have patients in their 20s that come in with a sciatic nerve pain.
Wow.
In fact, I had one today. So there's many causes for sciatic nerve pain, and that's why it's important to have an exam to see if we feel like it's coming from your disc, to see if we feel like it's coming from outside your pain, outside of your spine, what's causing it. So, you know, I like to get to the cause of something.
Right.
If it is a disc problem, I'll let you know what you probably need decompression. If it's outside of the spine, you know, you may need some muscle therapy, some adjustments, different things like that. But chiropractic adjustments alone generally do not help recurring disc problems.
Right.
They need some further treatment. So to help a patient get stable again.
Sure.
Yeah. And so if you haven't responded to repeated chiropractic treatments or other treatments, and you keep having to take those steroids again, you know, we'll look at your MRI. You can have a consultation at no charge and see if we can get to the cause of this to keep you from having those surgeries, to keep you from having those epidural steroid injections, because a lot of people are going in for that. But I tell you what,
it's not good for you over a period of time.
You know, if the disc is already bulging, that's a great way to herniate it, because you're not going to
Really?
feel what you're doing. You're just going to keep overdoing your back without that disc getting corrected. And so it's like treating the cause is really important.
That's the major thing, you know, treating the pain in the butt.
Yeah.
No matter how much he loves you. I'm sorry, I had to throw that joke in there. So again, if you're having some issues with things like that, sciatica, lower back, or whatever that's causing you some pain, and you know, don't keep trying to take pain medication to hide it. Make an appointment with Dr. Sonia Spencer, Spencer Chiropractic. They're located on Pass Road in Gulfport, right across from Pass Road Elementary, and you can get some relief.